Hi, my name is Dr. Elizabeth Dinh, and I'm here with Carly today, who is here to get tooth number 20 and number 3 extracted. Hi, Carly. How are you doing today?
Good.
Good. So what brings you in?
I'm actually having a lot of pain on my upper right and my lower left.
Oh, I'm sorry to hear that. We'll see what we can do for you, okay? So first I want to go over your medical history, okay? So since the last time I saw you, do you have any new medical issues?
No.
No? Okay. I see we don't have any allergies. Any new medications you're taking?
No.
No? Okay. Are you pregnant?
Mm-mm.
Any vascular disorders?
None that I know of.
No? Okay. Have you had any problems with local anesthesia in the past?
No.
No? Okay. So the reason I asked Carly if she was pregnant or had any vascular disorders is because if she had said yes, then we would have had to defer extraction treatment for today. Alright, so after reviewing her current and past medical and dental history, I looked at her radiographs and determined that tooth number 20 and tooth number 3 cannot be saved and need to be extracted. Alright, Carly, so the plan for today, we're going to extract your upper right first molar and your lower left second premolar. And I'm going to give you this consent form here to sign if you agree to the treatment plan.
Okay.
Alright, perfect. And now before we get started, I'll just take your vitals. Okay, so this is our basic setup for local anesthesia. We have protective eyewear, gloves, a mask, tongue depressor, topical anesthetic, which is 20% benzocaine, cotton pellets, a syringe, short and long gauge needles, 1.7 milliliter carbules that contain 2% lidocaine and 1 in 100,000 epinephrine. So to assemble a syringe, I'm first going to pull back on the thumb ring. I'm going to pick my carbule and insert it, and then I'm going to select my needle and insert the short end and secure it, and then I'm going to push back on the thumb ring to engage the harpoon into the carbule. Okay, now we're ready to deliver the local anesthesia. So I'm not wearing protective eyewear or a mask for filming purposes, but in a real case I would. So first we're going to do the inferior alveolar nerve block. So I'm going to reach around the patient and retract her cheek, feeling for the coronoid notch. Then I'm going to insert my syringe lateral to the pterygomandibular raphe, and I'm going to go in parallel to the plane of occlusion over the contralateral premolars. So I'm going to insert the needle until I hit bone. I'm going to pull back slightly and then aspirate. If I don't see any blood, I'm going to go ahead and inject the rest of the carbule, and then I'll wait until the anesthesia kicks in. So next we're going to do the long buccal nerve block. So once again, I'll have the patient open their mouth and retract their cheek. I'm going to go in parallel to the posterior molars on the buccal side, and I'm going to insert my needle buccal and distal to the last molar. I'm going to go in 1 to 4 millimeters into the mucosal membrane. I'm going to go ahead and aspirate. If the aspiration is negative, then I'll go ahead and inject the carbule. So the last injection we'll do is a maxillary infiltration. So I'll go ahead and retract her lip and go in at a 45-degree angle towards the apex of the tooth that I would like to anesthetize, which is number 3. And then I'll go ahead and insert the needle and inject. Once we've finished with injections, we have to disassemble our armamentarium. We'll start by using the one-handed scoop technique to cap our needle. And then we'll disengage the harpoon by pulling back on the thumb ring. The carpule and the needle will need to be discarded in the sharps container, and then the syringe will go into a red bag, which will then be returned to the dirty side of the supply desk. So once we've determined that the anesthesia has set in, we can start with the extractions. First, we'll go through the extraction instruments that we'll be using, which include elevators, forceps, and the Minnesota retractor. The elevators are used to expand the buccal lingual shelves and to loosen the tooth. They can be used as wedges, levers, wheels, or axles. There's many different kinds of elevators, but the most commonly used ones are the straight elevators. So you always want to make sure that you're using a finger rest with adequate control to avoid damaging surrounding structures. You want to come in at a right angle to the long axis of the tooth at the CEJ and turn the elevator in a clockwise direction. Once the tooth is elevated, the forceps can be used to luxate the tooth and remove it from the socket. Using the hemostat and gauze, apply pressure to the site to control bleeding. The Ronger instrument and the bone file is used to recontour the bone, and it's very important to irrigate the socket using the mono-eject syringe with saline solution. You then want to use the needle driver and suture to suture the papilla or flap. So once the procedure is done, we want to make sure that the patient is doing well and to send them home with some post-operative instructions. So Carly, how are you doing?
I'm doing well.
Good, good. So I just wanted to go over a few things with you before I send you home. So I have some gauze for you. You can go ahead and take that home with you. And what I want you to do is to place pressure on those extracted areas for at least 30 minutes before you change them out throughout the day. Okay? I also want you to avoid drinking out of straws because those could cause dry sockets. I also, for the next few days, I also want you to avoid brushing directly on those extracted areas, but go ahead and brush normally everywhere else. And then also if you're experiencing any pain, you can go ahead and take over-the-counter Tylenol. Do you have any questions for me?
Can I eat normally?
For the next few days, I would like you to try to stick to softer foods. Do you have any other concerns?
I don't think so.
No? Okay, so we're going to have you come back in next week to check on how you're doing. If you have any problems or feel like there's an emergency, you can go ahead and contact me.
Okay, great.